most of the things, but a few things, for example, heart murmur, palpitations, pregnancy. We created a single approach. In that single approach, what we are going to do, we are going to create something like summaries. So in that summaries, what would be basically, you will be seeing on that book, ebook, you would be seeing that simple questions, what the presentation. So they have given these presentation, these are presenting complaint, and these are the condition. So we'll write down the possible presentations, chest pain, cough, cyanosis, that would be written the possible presentation in that table or in that content. Then will be condition. You will give you the 2 scenarios each for that condition, common way that can present in the hospital setting. And after that, we'll tell you the whole history taking part. Then we'll show you possible positive finding in history, that you will get all the possible positive finding in the history. And the next part, you will see the examination, possible positive findings. So you will go through that, and at the end, we'll just give you management. In this way, you'll get the possible positive finding, all of this, and you will also get the possible positive finding in examination and 4 or 5 points on that management. So the ebook would be launched today for the cardiovascular. So we have updated most of the topics. So you will have a look, you will find out what and how we have done, and we'll talk about that anyway. So you don't need to worry much. In next 10 days, we make sure we'll create that ebook according to the UKMLA content map, 100% ready, inshallah. So that's fine. So now, Isha, so let's do the hematology first, okay? You tell me script, which you will act like a doctor. You tell me script, I will act like a patient, and then we'll do that. Tell me script, then I'll show them algorithm as well, students, okay?
Okay. Sorry. Let me send you the script.
Yes, sir. You can send me script, and I want you to tell that script as well to the students, so the students would know that how we would be acting. So you tell me script in front of students, that in a generic way, so that they would know how to practice and how to do that. Okay. Yes.
Wait a minute.
No problem. Guys, anyone who is having an exam nearby or something like that, please send this link, what you connected. You can send all of the people who might need to see the simulation or anything. The more people will see that, they will find out what we are and what we can improve on. Okay, so let me do it like a leukemia. So we'll try to do the leukemia scenario, Isha, okay? So just give me script about the leukemia.
I'm also sending you a case as well.
Okay, no problem, no problem. Because we are trying to make it more generic so that you guys would be able to see how the leukemia would be done. Then I'll show you algorithm for the leukemia as well. So, okay. Before she send me the scenario, let's quickly do the algorithm for leukemia as well. Okay. So let's do the algorithm first, and then we'll do the simulation. So algorithm will tell you how she is scoring and how she would be scoring on those particular aspect of that.
I have sent you a case regarding hematology. It is not leukemia, but it is in.
Okay, no problem, no problem. So what I'm going to do now, so I'm going to quickly share my screen with you guys to walk you through the approach to leukemia, or sometime related to hematology, what things you can suspect on the hematology. I'm going to share my screen, and you'll see algorithm in which I'll be telling you about how you will do with the cases coming with the leukemia. Okay, right. So you might see this case in that way. So it would become in this way. So generalize. So the patient might present history of presenting complaint could be like generalized tiredness, nosebleed, bruising. So how would you do? Can you please tell me more about that? Again, the checklist point of view, and how did it started, how and when, how long, suddenly or gradually. Have you noticed this nosebleed or tiredness? Have you having tiredness for a long period of time? Is this pain, if there is a pain, is moves elsewhere? or if is a generalized tiredness, change over time, ask about the time, anything make it worse or better, give options. So if somebody is tired or having nosebleed or bruising, so you first thing you'll be suspecting the red flags. So what would be the red flags? So you'll be thinking about low grade fever, lumps and bumps in any part of your body. By any chance you notice any weight loss, then you will ask about triad as well. Why you will ask about triad? Chest pain, shortness of breath, and cough, because someone is coming with similar symptoms, like where you can try to rule out something coming up with the respiratory system or cardiovascular symptoms. So if it is applicable according to the system, why if somebody is tired or somebody's that could anemia could cause tiredness, and somebody's having heart racing or something like that, you try to rule out problem in the breathing as well, because if somebody's tired, they might be tired due to anemia. That's why you need to ask about problem with the breathing. So you can ask feel sick, you can ask about opening about the bowel if you need to. You ask about fatigue and the malaise in the joints, like do you feel pain in your joint, do you feel dizzy at all. You'll think about heart racing, the same thing about the shortness of breath. You can ask about palpitation, heart racing, recurrent infections, because if somebody is getting something like similar to blood condition, that they might have low immunity as well, blood, because their blood may be deranged, or bleeding through the gums. By any chance you have noticed that you're brushing, have you noticed and bleeding from your nose? Rashes as well, you can ask about, because rashes is one of the things. If the patient is young, you need to ask. Rashes is one of the things that would rule out red flags. Naftosa, signpost, thinking about general health, non-allergies. By any chance do you have non-allergy? By any chance you're on blood thinners? Because if somebody is coming with these type of things like bleeding, you must ask about blood thinner. I'm sorry to alarm you. By any chance do you know to have family history of cancer? Do you ask about job, diet? There's a signpost, thinking of your lifestyle, diet, exercise, smoke, alcohol. Walk me through these type of things. Psychosocial, any problem at work, home, driving, you do ask if you need to ask those questions. Communication tools, have you given a thought, concern, specific concern today, biggest concern today, that might be worried about any blood disorder, cancer. Observation, I would like to take your observation. I would like to see your mouth, into your mouth or tummy, have a feel of your tummy. I might want to see your skin to look at any bruises. I might need to give standard blood investigation, urgent. I want to check the blood film as well to see any signs of that. Explain finding. First, leukemia is a cancer of white blood cells. If you find leukemia, explain and